Hi, my name is Olivia Velez, and today I'm going to be presenting on my project, Conscious Leadership for Women in Digital Health. So, to give a little background about myself, I'm co chair of the Global Digital Health Network and Chief Digital Health Officer at IntraHealth International. But when we talk about ourselves, we shouldn't just talk about our jobs. So, to give some other background about me, I am a mom, I'm an avid reader, I'm a reformed meditator, which is relevant to my talk today, and I really like to exercise. So, to give a little bit of information on my WomenLift journey, when I started the program, I was health informatics lead at ICF, and my project was going to be around gender and data use. However, in May of 2022, I joined IntraHealth International, and I wanted to change my project to reflect my new job and my new role. However, in July, I hit a bump in the road, literally, when I had a concussion. In that time, I wasn't allowed to read or use computers or do anything really, just sit around and try to recover. And that made things really challenging, especially being in a new role. So I spent a lot of time actually really learning how to meditate, which was one of the few things I could do, and also reading books. And that's how I came up with the idea to do a workshop on conscious leadership for women in digital health. So, what is conscious leadership and why do we need it? So, conscious leadership, the way I really think about it, is really leading from a place of self awareness about my motivations and my leadership goals, um, being in alignment with the purpose and the why behind the work that I do, and being a real person, not thinking about cooperate competition and working against people and winning at all costs when the challenges that we're trying to solve are really difficult. Sometimes we use language like the fight against AIDS and the war against poverty, and these are very aggressive terms. And really, we want to think more holistically about supporting people, improving population health, and making people's lives better. So you need to know your why. What are your motivations, and why do you do things? And center that around your purpose and your work. So for me, I've always been a tech geek. I was a software developer originally, but when I went to nursing school, my very first job off the night shift, I was working by myself because the other nurse called out. And I just thought, nurses shouldn't be alone and nurses shouldn't work alone, or any kind of health worker should ever be alone and be scared and confused about what they're doing. And the idea of using technology to address that problem was one of the things that motivated me. Also, working in digital health, there isn't one solution, one application, or one ring that's going to fix all our problems. So we need to work together to integrate technology solutions to solve problems. And that requires cooperation and linking and working together, and not challenges and other things where we're fostering um, co- co-opetition instead of cooperation. So my idea was to have this workshop ahead of the Global Digital Health Forum. So the Global Digital Health Forum takes place every year in December, where we bring together practitioners in global digital health. And so we did this as a pre-conference workshop with 30 women. And there's some pictures of the event here. There was high demand for the event, even though I didn't get to send invitations out until November. We had a lot of people express interest, and we accepted everybody who was able to come. So we had 30 women come. The workshop was free. We only charged for food for the day for lunch for people from high income countries. We did group sessions, we did small group sessions, we did a reciprocity wall, which is where you share what you're willing to do to support women in the group, and they share what they're willing to do and how they can help you with your problem. And we were also able to get support on the event. So we got sponsorship from Precout Foundation, and JSI let us use their offices for the event. And Lead for Good was able to do the facilitation of the event. So it was really great. And a lot of other women who participated in organizing and helped out with getting lunch and things like that. So this is some of the feedback that I received from our post survey. But the most important thing is people just made them feel welcomed and feel a part of the group, and know that many other women in leadership roles were facing the same challenges that they do in their everyday work. Another important part about leadership is made in this quote here, but how do we pass it on? So I'm hoping that the leaders in this group will serve as mentors and sponsors to other women working in the digital health space. and some other efforts going forward. So I collaborated with the groups who are launching the African Women in Digital Health event that took place at CPHIA this year. And I'm hoping to continue to support that work. We're hoping to have a longer event at the Global Digital Health Forum next year, maybe a 2 or 3 day workshop and support more people attending. And we're also hoping to have online and virtual groups that can help women in this space connect. And that's my workshop and my project. You can reach me at my email address, and I'm happy to answer questions.